Hi, my name is Matt Scahill. Thank you for tuning in today to this slide presentation on fertility acupuncture. In terms of my background, I'm the owner of Poplar Wellness Center. At the center, we provide services of acupuncture, meditation, massage, and clinical therapy. With respect to fertility acupuncture, I've had a focus on that since about 2008. Each week, I treat anywhere from 20 to 40 patients for a variety of fertility issues that have been diagnosed. I'm also certified to provide acupuncture on site at some of the local IVF reproductive medical facilities. Principally, that's at Mainline Fertility in Bryn Mawr, Pennsylvania. The question is, why fertility acupuncture? And the very straightforward answer is it improves outcomes. With respect to research that's been done, you'll find that acupuncture lends an additional 20 to 60% improved success rates around in vitro fertilization. I also use it week in, week out to help with the side effects that are encountered with some of the prescription meds that are used in connection with the assisted reproductive technologies. And I'm thinking here of the meds in particular, such as Lupron, Menopur, Follistim, and things of that nature. And frankly, it also is very good at acupuncture is good at reducing the routine stress associated with the fertility process, which can be quite high. When I first meet with a patient, what I want to do is sit down with them and take some time to understand their goals. And that means discussing their health history and the recent clinical diagnoses they may have received with respect to their fertility, what tests they have completed, what tests they have planned. And we're also going to discuss any interventions that have taken place so far, including things like IUIs and IVFs, and what have the outcomes been like. In that conversation, what we try to do is then bridge it back to traditional Chinese medicine so that I can craft an acupuncture treatment that's going to help them maximize the result. So we're doing some basic things week in, week out, such as balancing the menstrual cycle, and as I mentioned before, easing some of the adverse side effects with respect to the prescription meds that are often introduced. In terms of the acupuncture treatment specifically, most patients do see me on a weekly basis. And typically each session is going to last anywhere from a half hour to 1 hour with an average of, I'd say, about 40 minutes. Each week, what we're doing is assessing what happened following last week's acupuncture treatment, understanding any new signs or symptoms, and talking about any tests or monitoring that's taken place, and adjusting the acupuncture treatment to where they are in the context of the fertility process, the menstrual cycle, and the overall goals. And once we get to reach that goal of positive pregnancy tests, we're continuing with the acupuncture for about 8 or 9 additional weeks. We're watching along with you some of the early milestones with respect to a positive pregnancy outcome. We're discussing things like the beta numbers that you're given via the blood test and information about the gestational sac, the fetal pole. At 6 to 8 weeks, we're usually getting the news on the heartbeat, the heart rate, and all the while information on your progesterone levels and what adjustments may be occurring with respect to progesterone medications that you're taking. And we're treating with acupuncture to help with blunting some of the nausea, fatigue, and stress that are encountered in the early weeks of pregnancy. And we're also using it to control any spotting if that's happening with an eye towards preventing miscarriage. So to recap, fertility acupuncture is all about understanding your history, your goals and connecting your fertility goals with Chinese medicine and acupuncture in particular, and getting to the right acupuncture treatment each week to help you along the way. And we are adjusting. So there's certain overlap week to week in terms of the point selection, but usually there's something that's happening each week that's unique that we're responding to again get to that positive outcome. And then beyond the early part of pregnancy, we can continue with acupuncture for some common aches and pains. And at the end of the process, we can use acupuncture to do a couple of things. One would be to turn a breech baby at approximately 30 weeks. And at the end of the process, 38, 39, 40 weeks, we can use acupuncture to bring on labor. I hope you find this information has been helpful. And if you have any questions, feel free to call the center or visit us. We'd love to see you. We're at 8th and Fairmount, and you can check us out at poplarwellness.com. Thank you.